Hi, I'm Anne-Marie Cardenas, and my presentation is about rabies. So rabies is a preventable viral disease in mammals, which is most often transmitted through the bite of a rabid animal. Majority of the cases reported to the CDC occur in wild animals such as raccoons, skunks, bats, and foxes. Rabies is caused by the rabies virus, which infects the central nervous system and ultimately results in death. It has been documented in every country with the exception of Antarctica. A little bit of history behind rabies. It dates back to 12,300 BC in writings by the Egyptians. And so it has a very, very long history with many proposed causes of rabies and many different remedies. So the earliest case in the Americas was in 1703, reported by a priest in Mexico. In 1769, pathologist Morgani speculated that rabies is carried by the nerves. In 1804, German scientist Zinke proposed that rabies is passed through the saliva, and Louis Pasteur and his assistant created a rabies vaccine from the spinal cord of an infected animal. In 1885, Pasteur successfully immunized the first patient, Joseph Meister, who had been mauled by a rabid dog, with his rabies vaccine, and was then seen as a hero. To the right, we see Pasteur. A little bit of taxonomy of the rabies virus. It's in the order Mononegavirales, the non-segmented negative stranded RNA genomes. It's in the family Rhabdoviridae, where they have distinct bullet-shaped viruses, and in the genus Lysovirus. The structure of the virus, it's approximately 180 nanometers long and 75 nanometers wide. The genome encodes 4 or 5 proteins: nucleoprotein, phosphoprotein, matrix protein, glycoprotein, and polymerase. 2 main structural components, a helical ribonucleoprotein core and the surrounding envelope. The glycoprotein forms about 400 trimetric spikes, which are arranged tightly on the surface of the virus. There are pictures over here of the bullet-shaped virus where you see the envelope and the core. In the cross-section, you can really see the spikes on the surface of it, and then on the left is a picture of the rabies genome where there's those 5 proteins. So the replication of the rabies virus is the same as every other virus. There's absorption, penetration, encoding, transcription, translation, processing, replication, assembly, and then budding of new viruses. There aren't many ways to be exposed to the rabies virus. It's usually through the bite of a rabid animal. It's also possible to transmit if the infectious material, the saliva, gets directly into the eyes, nose, or mouth mucosal membranes, or an open wound. Inhalation of aerosolized rabies virus is a potential route. However, that only really pertains to laboratory workers. Human-to-human transmission has occurred, and that's only been in patients with transplanted corneas and solid organs from an individual who had rabies. Any other contact, like petting an animal or contact with the blood, feces, or urine of a rabid animal, doesn't constitute as an exposure, and the rabies virus becomes non-infectious once it's dried out and whenever it's exposed to sunlight. Path of the virus. As mentioned before, it's usually introduced into the muscle by a bite from a rabid animal, and it travels through the nerves to the spinal cord. At this point, in the incubation period, maybe starts to feel numbness or tingling because of the nerves, but that individual or animal is not infectious because it hasn't reached the saliva yet. After the incubation period, the virus goes from the spinal cord to the brain. This is where animals start to show the first signs In the brain, the virus multiplies very rapidly and causes inflammation of the brain, or encephalitis. And then it passes on to the salivary glands, where the individual can become infectious. Usually after about 7 days of showing those signs, an individual will die. So I've arranged the symptoms into a timeline during the incubation period. As mentioned before, there's only really pain on this and tingling at the side of the bite. This is a very long incubation period, 20 to 90 days. That's about a month to 3 months. The prodromal phase, 2 to 8 days, is when we see fever, poor appetite, nausea, vomiting, headache, and lethargy. However, these are very non-specific symptoms, and so until we get to the acute neurological phase, which lasts 2 to 7 days, and that's where we see the hyperactivity, disorientation, hallucinations, seizure, hydrophobia, aerophobia, paralysis, or weakness. Hydrophobia and aerophobia is the intense fear of water, and that's caused by pain from the tightening of the muscles in the throat. Depending on whether it's paralytic rabies or furious rabies, the paralytic rabies, we don't really see such dramatic symptoms, and the individual will gradually fall into a coma and then die from kidney or lung failure. But with furious rabies, we do see these intense symptoms, and their death will be caused by cardiac arrest usually. So depending on the contact, there are different measures that should be taken. Category 1, which is touching feeding animals and licks on intact skin, there should be no measures taken. The person is fine. For category 2, that's nibbling of uncovered skin, minor scratches or abrasions without actual bleeding. This should still be treated with immediate vaccination and local treatment of the wound. Category 3, where there's single or multiple transdermal bites or scratches, licks on broken skins, or contamination of those mucous membranes with the saliva or contacts with bats. There should be immediate vaccination and administration of the rabies immunoglobulin, which I'll explain later, and local treatment of the wound, of course. So I've only included the ways to diagnose rabies for a human, and that's in the saliva, which can be tested by virus isolation or just reverse transcription followed by polymerase chain reaction. Spinal fluid is tested for the antibodies, and skin biopsy is examined for the rabies antigen. And the antigen can be seen in the direct fluorescent antibody test. Here on the left, whenever it's dyed, we see these dust-like fluorescent particles of the antigen, and then on the right, we see a negative test for that. So there are 2 different rabies vaccines, human diploid cell vaccine and the purified chick embryo cell vaccine, and both of these can be used for pre- and post-exposure. Pre-exposure rabies vaccines are administered for those in increased areas or who are traveling and are going to be at a risk for rabies. And so those are administered in 3 injections. The first can be given at any time, the second is 7 days later, and the third should be given 21 or 28 days after the first dose. Booster doses are recommended every 2 years for those who continue to be at those at-risk situations. Usually, an individual receives a post-exposure rabies vaccine, and the doses of those depend on whether they have been immunized before or not. For those who haven't been vaccinated for it before, they receive 4 injections immediately, 3 days after, 7 days after, and 14 days after. And it's for these unvaccinated people who should receive the human rabies immunoglobulin. And this helps with a rapid protection until your body can make its own antibodies. For those who have been vaccinated before, however, they only receive 2 doses, one immediately and the other one is 3 days afterward. And at this point, the immunoglobulin isn't needed. Ways to prevent rabies: vaccinate your pets, maintain control of your pets in order to reduce their exposure to wildlife, spay and neuter your pets in order to decrease the number of stray animals, and report any stray or ill animals to animal control, and definitely keep away from unknown animals, especially wildlife. Here are my sources. Thank you for watching.